Hello, how are you? Welcome again. This is another episode here. We want to talk about shoulders today.
Let's do it.
So for those that, if you don't know me, my name is Chris. I'm a physical therapist, EHS Physical Therapy Chiropractic, as well as Essential Motion Spine and Sport. And with me today,
Yeah, I'm Dr. Jake with Essential Motion Spine and Sport. I'm a chiropractor here.
as always, the shoulder, very complex joint.
Very.
We see a lot of, let's back up just a second.
Yep.
So when we look at someone that has shoulder pain, whether they've had, a mechanism or an injury or not, we always, we have to take into account the possibility for a neck thing that's causing pain out into the side or into the shoulder and arm area. So we know that at least, between 4, 5, 6 are going to have that. Now we've ruled that out, so now it's truly a shoulder.
Yep.
And there are a couple of structures that surround the shoulder. There's a joint capsule.
Yep.
There is some muscle, so the joint capsule, the ligaments, all that kind of stuff is, and the labrum is kind of a static stabilizer, helps form the cup where it goes into, gives it some structural rigidity. And then the muscles around the outside, rotator cuff muscles, you got 4 of those, the deltoids, the big lats, the long head of the biceps, the pec.
Tricep,
Yep, so those are all your dynamic stabilizers that can move and change and really sink down and give us all that mobility, plus stability in the shoulder.
Yeah.
So let's say that we're dealing with something where someone has maybe dove, or we had a guy yesterday who came down with a rebound and the arm kind of went funky in like this. We have another young lady who's a volleyball player who dove out and tore her labrum as well.
Yes.
So let's go over the 2 most common, and then let's go look on a picture and kind of show what it looks like.
Yeah, let's go over here and kind of point some things out as we're talking about it. Okay, so maybe this picture would be a good one to start on. So right here you can see the shoulder blade or the scapula itself. Here's the glenoid part of the shoulder blade. That's where the ball of the humerus would sit into. Kind of like up here, you can see everything connected together. Here's another view. You can see the ball sits kind of like on the golf tee as we kind of sometimes explain it.
We have another video that explains the...
Yeah, we do. Yeah. We have the white part here, which just deepens the socket for the ball of the shoulder to sit into. So that helps create a little bit more stability in the shoulder, okay? So you can have...
It makes the rim of that golf tee a little bit wider, deeper.
Yeah. Yep. So you can have injuries to that labrum. Here you can demonstrate a little bit of tear on the front and bottom side. So the 2 most common types are what we call a slap tear. So the superior labrum.
That's just an acronym. That
just means slap. Superior labrum, anterior, front to back, posterior.
And a lot of times it has to do with that long head of the bicep.
Yeah, so you can see the long head of the bicep shooting off right here. So that can actually tear away that top part of the labrum. That's probably the most common one. You'll have pain with overhead movements. You'll have weakness. You might have catching, clicking, grinding, clunking. You might even feel shifting. There's a bunch of different symptoms you can experience. The next most common would be the lower front, so the anterior inferior side, which you can see here. So that people tend to not like the throwing position where you come back here, you feel like your shoulder's going to pop out.
Yep. Maybe making a tackle in football, you reach out and someone so I'm coming
Breaks
through.
Back.
You reach out and tear that, or even a dislocation of the shoulder.
Yeah,
if that dislocates, sorry,
there you go. There's a picture right
dislocates and it slides down, it can take a piece of that labrum off as the humerus comes out of the socket. It can shear off part of that. So that's maybe from a more serious injury like a dislocation.
And then the guy we had in the other day,
we have 2 of them right now.
We do. We have a couple labrums going on. But the guy we had in come in the other day, he's got probably the least common type of labrum injury that we're talking about. So we think he's injured on the posterior inferior side. That's literally 10% of all shoulder labrum injuries. Mm-hmm. So that's the guy we were talking about where he came down, landed on somebody when grabbing a rebound and got cranked into internal rotation. Well, that movement there really stresses that back side of the labrum.
Yep. Horizontal adduction along with some internal rotation.
Crossbody and internal rotation. So that has very vague symptoms, but he feels when he's going to steal a basketball, he comes into that position, he feels as if his shoulder is going to pop out of place. That's the best way he can describe it. So
the other young lady we had, the volleyball, is a posterior labral tear and a repair. Surgical, they call that a Bankart lesion. Yes. And she dove onto the floor to get a ball and had kind of some odd symptoms too. Couldn't elevate the arm very high. Sometimes she could, sometimes she couldn't. We knew it was mechanical and the fact that it would change, but we were not able to make consistent changes that, that lasted. So then she had to get a little bit of a repair in there, and now she's coming along. It wasn't a contractile tissue like a rotator cuff. It was purely the posterior. Yeah.
So Chris, from a treatment standpoint, a tear in the labrum sounds pretty serious. Is there things we can do in our office, or is this something that we require surgery for? What can we do here?
Yeah, so that's a good question. So I think we should probably, which we usually do, attempt some conservative treatment first.
Absolutely, I agree.
Sometimes we can get the correct, movement or combination of movements to get little pieces of labrum to kind of, slide back down or move out of the way, and then they feel fine. It also depends on if there's blood flow or not.
Yeah.
So the shoulder notoriously doesn't have great blood flow. So depending on where that labral tear is, if it's got some good blood flow, it has a good chance of healing conservatively. If it doesn't, and after the course of, say, a couple weeks of we're trying, and it's really not making any improvement, a la our volleyball player. We saw her for maybe about 3 to 4 weeks, on and off, and then nope, it's not getting any better. Okay, she probably is going to do very well now since she got that thing kind of just stitched down. I think with our basketball player or the taller guy that we saw, he probably has a pretty good chance of getting it just conservatively over time, just getting it to smooth down, calm down, and heal conservatively. So yeah, and even if it does require surgery later, there's still a bit of say prehab or pre-treatment we can work on, strength in other areas that don't hurt, right? Because he can do all this stuff. In fact, if he can bench press really well, all he has to do is just kind of rotate his hand out, then it doesn't hurt. As soon as he rotates it down, that hurts. So we could strengthen and do all kinds of stuff around that shoulder and buy it some time to get it to kind of calm down a little bit.
Yeah, so if you have an injury to the labrum, that's one of the biggest, we call it a passive stabilizer. One side is stretched, it's hard for that piece of tissue to heal, but if you can create more dynamic stability through the rotator cuff muscles, you can compensate for that by using your muscles to create more stability there. So that's where the rehab or even prehab comes into play.
To control where it's at in space, because the shoulder has the ability to be very mobile, but unlike the hip, it's not very stable. It's common, there's not a lot of stability. There's a lot of mobility. The hip, the other most common ball and socket joint, has a lot of stability. Because we walk on them all day long, but it doesn't have nearly as much mobility as the shoulder does. So it's give and take. We don't walk on our hands as much. So
there's options, and a lot of the things that might go into your decision making is how much does this really affect you in your day-to-day life. It doesn't affect you much. It only affects you with certain things that you don't do too often. That might be more of a conservative case. If you're a volleyball player or a high-level athlete and this is really limiting your ability to play, speed. You might want to get that. Go get it trimmed or stitched right away. It will hasten or speed the healing time. You'll still have rehab.
Now it's touched down there where it needs to be, but you still have to move. We're back to moving this thing. Within, she had it on a Wednesday. I saw her on a Friday. We started doing stuff right away. The other fella, he can work on things on his own at home with certain things for a while, and just see because it doesn't affect other parts of his life at all.
No,
it's just in here or just with heavy lifting and stuff.
Swing,
so But we made some slight just modifications by turning the wrists a little bit. Then it didn't hurt. So he can keep working, and the vast majority of things like that will go away with time and consistent effort. But yes, we'll help you kind of weigh that decision on whether you need to go in right away, maybe wait a little bit, and depending on your goals, the solution you're really after in the long run, because it's not about because it's not about just pain relief.
No, it's about
there's a bigger issue, there's a bigger want or desire or goal that you have, and it's not just pain relief, because you could get that by taking a pill, but if you can't get back to doing the things you want to do and you don't feel strong, you don't feel mobile, you don't feel confident in your ability to move,
swinging,
then you're not there. So we got to work on that stuff. But
okay,
that's the shoulder labrum.
Labrum in a nutshell.
And that's the three most common lesions: the upper, the inferior, and the posterior. So
perfect.
Got it. Thank you.
How's it going?